Good morning, everybody. I know we are fast and furiously trying to deal with this new workplace legal challenge. There's no way I can get through everything in thoroughness in the time I have allotted. So bear with me. I hoped that I timed this so that I can take some questions at the end. The first thing is to give you the disclaimer that I am shouting to the mountaintops these days, which is everything I am saying in this presentation can change and probably will change. So realize this is what you're getting today. Tomorrow, it could be totally different. In a week, it'll probably be different yet again. But hopefully the structure that we have here is going to help as we wait to see when the vaccine's available for everybody, wait to see if we're going to get more guidance on workplace vaccination, etc. I normally save resources for the very end, but I'm giving them to you at the beginning because I'm going to refer to them as we go through them. So this isn't an ad. This is designed to give you some help. My firm has posted lots and lots of information related to COVID-19 on its website for free. We made the decision that we felt we actually had a public service duty to help out particularly small businesses in this pandemic. And we've set up a vaccine resource center. Here's the link. I will be sharing these slides with everybody through Teddy, and she can get you a set today. What it has is a table of contents. I've given a little cut and paste here. You can see that one of the things that we're giving you is some templates and forms that you can use. Our COVID-19 vaccine FAQs are excellent. Events is maybe when we're having another speaking engagement about it. And we've actually been putting up articles every few days as we learn developments on a federal level. I haven't done an article on Washington yet because there's not been much yet quite to report, but you could look at that for here. And of course, I share anything with the association when we do. I'm going to refer back to this as we go, so I wanted you to know what I was talking about. The next thing that's probably going to give you more in depth of what I anticipate everybody's questions today will be this article that we just posted about what are the risks with having a mandatory versus a voluntary vaccine policy in your workplace. I'm going to talk about these today, but here's a link to an article that talks about it in all of those topics in more detail. We have, I've put together 10 points that I think are the most common questions that folks need to be thinking through when you're deciding what to do for your business. So the first decision is, are you going to have a mandatory vaccine policy or are you going to have a voluntary program? And there's legal risks involved in both that I'm going to talk through. With that in mind, I want to hear your business reason and you need to be able to articulate it. Now, here we all are in food services on the phone, so you can see probably an idea of what it's going to look like for hospitality. Our workers are touching food. They're involved with serving food. We care about worker safety and our customers' health and safety. We have workers who interact with guests. These are starting to sound like pretty good business reasons to have a mandatory vaccine policy. More about that in a second. I want you to be thinking about how you're going to educate employees about your policy. Are you prepared to handle accommodation requests? Are you prepared to pay employees for their time to get the vaccine, particularly if it's a mandatory policy? You're probably going to have to do that. And if you're not having a mandatory policy, what are the options for incentivizing workers to get a vaccine without violating workplace laws? More about this to come. Let's get our heads around a little bit of the legal framework when we're thinking about this policy issue. Health and safety regulations are the first one. We might have federal OSHA regulations or Washington Labor and Industries. We might hear something from the city of Seattle. And of course, we've got CDC guidelines, although those do not have the force of law. We have concerns to discuss under the Americans with Disabilities Act and Washington's similar law against discrimination. HIPAA comes into play a little bit. There's wage and hour issues here. That's about paying people and also correctly calculating overtime. And then, of course, there's tax issues in addition to payroll taxes and some other things having to do with wellness programs. and also how you might be offering a financial incentive that we will talk about. First thing I'm going to say about the change in administration is we anticipate hearing more and more from federal OSHA as time goes on. That agency was fairly silent under the prior administration, leaving it up to the states, cities, and counties to come up with mandates. We've already gotten some guidance from federal OSHA encouraging some of the workplace safety rules. They do have the power to engage in emergency rulemaking. So we're going to have to just keep an eye out that we might be seeing some things coming from the feds that we don't have yet. My first decision point, as I said, was mandatory or voluntary. We have nothing from any federal or state agency saying that employers must vaccinate their workers. That could change. I suspect we probably won't be hearing about it until there is enough vaccine for everybody. So I can't quite tell if the reason we don't have those regulations yet is because they're not coming, or if there's actually thought about timing it with the availability of vaccines. Here's the first question that I get that I can answer is, can you have a mandatory vaccination policy? Well, in Washington and under federal law, so far, the answer is yes. And the first guidance we actually got, yay, was from the Federal Equal Employment Opportunity Commission. That's the agency that monitors compliance with the Americans with Disabilities Act. I've given you a link here that will discuss the EEOC's mandate and also take you to that more in-depth article from the EEOC. For those of you who might have operations in other states, I just wanted to point out that not all states have adopted this guidance. We're waiting to hear, or we've got some states maybe saying things to the contrary. California is one of them. So if you are operating in multiple states, you should be getting legal advice about whether you've got anything here that's going to prevent you from having a mandate. If you're going to have a mandatory policy, then you need to be thinking about whether you are complying with the Americans with Disabilities Act. And here's what we know. Just administering a vaccine or asking an employee for proof of vaccination is not going to violate the ADA. The ADA usually prevents employers from asking employees about medical information unless there's a reasonable accommodation request or unless we have a business necessity reason to do so. So the EEOC says it's okay to ask people if they've been vaccinated and they can show you their card or their email or whatever it is. That's fine. The next thing is a repeat of what I had on the prior slide because it's so important. The mandatory nature of this is going to mean that the employer needs to pay for it. More about that in a second. The reason that I want you to have an articulated reason why a mandatory vaccine policy is job related and consistent with business necessity is that we can quickly become involved in a reasonable accommodation issue if an employee says that they can't get the vaccine for medical reasons. Once we enter into that, we need to have a strong reason why this is related to our business to justify the further inquiry we're going to make with the employee. The other thing to remember is if an employee says that they have a medical reason that prevents him or her from getting the vaccine, you are going to need to engage in the interactive process. Obviously, you're all probably thinking ahead, well, what if they can't get it at all? Can I just fire them? That is a very risky proposition, and I would not want you to do it without legal counsel. In fact, it's going to be nuanced, but you're going to need to go through getting information from that employee's medical provider, exploring at least whether that there are accommodations you can give that employee, whether there are other jobs available that employee could perform. On the other hand, I want you to keep in mind that I'm just fearful of vaccines and I just don't think they're a good idea is not something that would justify an ADA accommodation. I've mentioned job-related and business necessity a few times here. This is, again, why it's important. not only is there an ADA issue, but sometimes when you start to ask an employee about why is it that they're asking to not take a vaccine, you can get into genetic information, which is actually yet another alphabet soup of employment laws under GINA. So again, having your job-related reason articulated and solid at the beginning is going to carry through all of these legal risks and should put you in good shape for when you have to have dialogue with folks. Now, if your policy is mandatory, again, I've said articulate how it's job related. You should have a policy. On that vaccine resource page that I gave you, we have a sample mandatory vaccine policy and a sample voluntary vaccine policy that you can use for your organization or as a starting point to make edits. Not only should you actually have a policy and you should publish the policy, you should be thoughtful of how you're going to communicate to your workforce, whether it's mandatory or whether it's voluntary. Setting up with the employees why you think this is important and why this is something that the company is doing is going to be very important in employee morale, having folks come forward with issues sooner rather than later, and also hopefully help the program roll out smoothly. As I've already alluded to, you'll need to be ready if the policy is mandatory to handle reasonable accommodation requests. There's another type of accommodation that you might need to have a dialogue with an employee about, and that's for religious accommodations. So if somebody has a bona fide religious reason that they will not get the vaccine, you again are going to have a dialogue with them about whether that's something you can accommodate, and this should be documented. Our website also has a sample accommodation process and procedure that you could share with workers that will hopefully help out there as well. Okay, the biggest one is for purposes of a seminar like this, our recommendation is that you must pay employees for their time to go get the vaccine if it's mandatory. Now, voluntary is different. This is if it's mandatory. And the star here is to not forget how you calculate the regular rate of pay. For somebody who's an hourly worker, the way that we calculate overtime is easy. It's 1.5 times their hourly wage. We don't count tips. We already know that. And so the time to go get the vaccine would be their hours worked. We would record it as hours worked for that week. If it kicked us into overtime, we would be concerned about that. Where this can get sticky is if you're trying to pay folks another way, even in a voluntary program. I've given you the law here for regular rate of pay and how we calculate that. The biggest thing on the bottom here is non-discretionary bonuses must be included. So let's say we're just going to offer everybody a $100 bonus if they go get the vaccine, even if we have a voluntary program. That arguably is more than de minimis, and therefore it would have to be included in the employee's regular rate of pay for the week. So that's a legal way of saying if you give somebody a bonus that all they have to do is just go get the vaccine to do it, you're going to need to consider that as wages for the week and calculate overtime.
Hey, what problem are we trying to solve?
So let's say you decided that this idea that I have to pay for the vaccine, the idea that I have to be ready for accommodations is all more legal risk than I want to take on, or frankly, deal with how to navigate right now. Maybe you know your workforce and you actually are very confident that they will jump on the chance to go get vaccinated if you encourage it. But perhaps you want to go ahead and offer some sort of incentive. I was just talking about the issue if it's a cash incentive, which is it might affect their regular rate of pay for the week. So I've gotten these other questions, and we've also discussed these ideas in more in length in that article I gave you. So we see a lot of employers offering employees a PTO day. Basically, they're saying if everybody goes and gets the vaccine on that day, we'll give you an extra day of PTO as an incentive. Now, you have to probably offer it to everybody or we're going to get into discrimination issues, but that's more than we can talk about here. If you offer somebody, you'll put some money in their HSA account, that also might avoid having to pay income tax or FICA taxes on that as well if you get advice from your tax advisor. So that can be an advantage as well. Had some other clients talk about doing prize drawings. Again, we get into that issue, everybody who gets vaccinated gets to put their name in a bowl to win an Apple Watch kind of idea. Not really sure how that's health related, but maybe everybody wants an Apple Watch. I guess you can get the health app. If that's more than de minimis, we might get into a regular rate of pay or a taxing issue, but those kinds of prizes are probably okay. There's also where you can get into trouble with the EEOC. They have some wellness rules here too about offering cash incentives for people to participate in wellness programs. So if the incentive offered is too high, you're actually theoretically coercing somebody into giving the employer health information. And that's something you could run afoul here. I think that it's a little bit more of a nuanced analysis with the vaccine, but that's something that you should talk to your counsel about if you're going to be offering really more money that starts to feel, I should say under the Trump administration, we had a proposed rule where anything more than like a free water bottle was going to violate the wellness rules. Under President Biden already in the last month, that proposed rule has been withdrawn. But when that happens, we don't really know what the answer is going to be. So it's probably going to be something more than a water bottle, but less than $1 million. Sorry for the lack of precision there. All of these payments have tax consequences to you as an organization, or you may need to be paying FICA on them. So be sure to check with your CPA. And again, I brought up the regular rate of pay issue. I'm just worried about folks doing some sort of cash incentive and sending folks off to get a vaccine. If the program isn't communicated correctly as truly volunteer, then you're also going to end up with wage and hour issues as well. So the way that works is the more a program feels like something you have to do as a condition of employment, then once we tell employees they have to go engage in that activity, they're actually owed wages for it. Of course, if the government says that we have to, that's going to be taken care of a little bit. The next bunch of questions that I get is around, well, what do I do if we have a mandatory program and the employee has an allergic reaction to the vaccine? So we don't have much law on this yet. Part of what we're borrowing here is our knowledge of what you do for annual flu vaccination programs. So I'd also, kind of as a side note, offer that to you. If you've gone through that analysis as an organization, you may already kind of have a roadmap for how you want to handle this with COVID as well. But for workers' compensation, it's more likely than not, that if you have a mandatory program where somebody needs to get vaccinated as a condition of their employment, that if they become injured because of that vaccine, then workers' compensation coverage is going to kick in. Now, that's good in the sense because it doesn't mean you're going to get a personal injury lawsuit from your employee, because workers' compensation provides immunity from that. But it's bad in the sense that you are taking on the risk that your rating might go up and you might get a bunch of workers' compensation claims, depending on if anybody has the reaction to the vaccine. Now, so far, that seems to be a low number of people, and so it may be risk that you can live with, but that's something to think about. And my last bullet point here is what I always say: your managers have to understand your program and get guidance on what they can and can't and shouldn't and should say to their employees, so that you don't create a legal issue really where none existed. Okay, next point here, and this is my last point, and I'll take questions, is you can also get a little bit sticky if you decide to offer the vaccine on site. You really do want to have a contracted third-party provider. In fact, it's even better if you're sending the employees somewhere else and not doing it on site, but you certainly could, hire Virginia Mason. At some point, we hope this is true. Like we do with the flu vaccine, we get some retired nurses to come onto our job site, and if folks want to go get a vaccine, they can. The reason why that's important is there's going to be all those questions that you have to answer when you get a vaccine, right? Have you been sick in the last 7 days? I don't even know what they're asking now, because I sure haven't had my COVID vaccine. But that's going to end up violating GINA or the ADA if the employer is asking those questions related to the vaccine. So there's a reason to have this contracted with somebody. All right, Teddy, how'd I do? That was a lot of information pretty quickly, but I think I've got about maybe 15 minutes left, 10 minutes left.
That was great. I did get one question in the chat, and then I had another question that was actually submitted prior to the meeting, which may be more for John, tag team this question. But for the first one directed to you, Catherine, can you ask for proof of vaccination even if you're not mandating vaccination?
Yes.
Okay.
Yes, you can. The EEOC has said that's not a disability related inquiry. Now, I want you to have a business reason for it. But again, with you good folks on the phone, I think we've got very strong arguments related to customer facing and handling food, right? We have food and health and safety issues all over the place that we all already know how to deal with. That's sort of what's so frustrating here. So you're going to have a justification for it, and you can.
Great, thank you. And the other question is, again, this is John, you might be able to speak to this more with our efforts at the state level, but we have still not, do we have any insight as to where on the vaccine rollout plan our employees may fall?
I do not have that memorized off the most. I want to say it's in like phase 2. No, it might be phase 3. I think it's phase 3, and I think there's like 4 phases that they have, but like with phase 1, they've broken it into 4 or 5 different parts. So I would say currently, late spring maybe would be a rough estimate just based on kind of what we're hearing. That being said, I do want people to know, and feel free to spread this word. I mean, any time we've talked to anybody about this, we have said we think our employees should be moved up and should be part of the essential worker main category, just like the other essential workers who are in the phase 2 category. We have talked to, Department of Health. I have mentioned it every time I've had an opportunity to talk with the executive office or the King County Public Health. I've made that, very clear, and I've talked with folks in the mayor's office. So just know this is an issue that we have been elevating. But of course, the response, that I got, when I raised it one time, a conference with Dow Constantine was like, yes, and the teachers want moved up, and the bus drivers, and and then like city employees who are coming. So there are lots of folks. There's a lot of demand. So, but it's not for not trying on our part.
Yeah, I mean, the legal answer is just as John alluded to, which is right now, food service workers are not far up the chain in terms of the phases for the vaccine rollout, which you can see on the governor's website. And I know that the association is advocating his pants off to get folks moved up. But there's a lot of pressure out there from the other industries, and the fact that we don't know when we're going to have as much vaccine as we need. So, who knows? Like I kind of alluded to at the beginning, part of it is I think that there's this idea that we can't move everybody up because we don't know if we have enough vaccine for everybody too. I think that's practically going on behind the scenes, as frustrating as it is.
Great, thank you both. I am going to I don't see any other questions in the chat. And as always, folks are free to unmute themselves as long as they know that I will mute you if your background noise is distracting. So I'm just going to give another 30 seconds. One more in the chat from Kate. Under a voluntary program, if we gather vaccination information on our employees, how should we communicate with our unvaccinated employees to encourage them to get vaccinated?
So, hi, Kate. We might need to talk more offline, but in general, you can't tell other workers who has been and who hasn't been vaccinated. The EEOC was very clear that that is protected health information. So can't do it by kind of what I want to say, peer encouragement. So this is where you need to be thinking about all of those options I went through about what you think might encourage workers to go get vaccinated, whether it's cash, a PTO day, some sort of raffle. I think that really should be probably your policy from the beginning, because you do need to offer it to everybody. You could go around and just offer an incentive to the people who had decided to delay in getting vaccinated. It needs to be something for the entire workforce. And so part of it is going to be, getting in front of the communications about how important you think it is for their job and for the public that you serve to get the vaccine. Again, this is all, kind of going back to what John was saying. I want to underscore, I don't know what's going to happen in the next 4 weeks here. So we may get, something that in some ways I'd almost like there to be a mandate that says that employers need to encourage this, because it would sort of take away a bunch of these other issues regarding incentives and also some of the legal protections, but we'll have to wait and see.
And one other question from Susanna. Can you shed more light on what a bona fide religious reason would be?
Yeah, so bona fide religious reason is a term that's been around for a long time under state and federal law. And so that we really have to have the inquiry with the employee that they're actually, practicing a religion. Now, we can't make judgments about whether we think their religion's legit. One of the examples I use when I'm training on this is Eric might have even heard this. I have an employee who's a Wiccan who can't work, on the summer solstice because of their beliefs. We probably have to go ahead and assume that's something bona fide. But, if I say the Church of Catharine doesn't believe in vaccines because I read this article on I started to say a social media website, I won't say, I read an article online, that's probably not a bona fide religious reason. The biggest thing is that it needs to be an individualized inquiry and a dialogue with the employee. And then you're going to have to take the risk analysis as to how far you want to push back. This is yet another reason why having your policy articulated as to why you think this is substantially job related and consistent with business necessity is so important, because in the end, we do get to questions about whether somebody's request to continue to work without having the vaccine, we can continue to have them as an employee, is going to come into play. But if we get to any sort of situation with discipline or termination, you really do need to speak to a lawyer. It's going to be a fact-based analysis for that employee. I know that didn't help much, but I hope that helps some.
Catherine, seeing as how there are limited vaccines, as we move, whether it's voluntary or mandatory, say restaurant workers go into a phase where they are eligible, how long do you give an employee to get one? Because at this point it's difficult to even get one, even if you are eligible. But what if it takes 3 months beyond the time and they are legitimately trying to get the vaccine? How does that work?
Well, I think that you would want to set a policy with a time frame for folks to get vaccinated that's realistic. I mean, we need to not be creating pressure where there is none. And then you're going kind of, 3 steps down the road. Well, if I tell somebody they have 90 days to get a vaccine because my program's mandatory, and then they fail to do that, I mean, you're really getting to the question as to whether you can terminate them. So that's going to be factually based, Eric, sorry. But look, as long as this is one of those things, kind of we can borrow from when we deal with FMLA, if anybody's had to do that, or even accommodation requests, we need to give employees a reasonable amount of time to go to the doctor or get us a note, or here it would be to get the vaccine. And if we talk and we realize, I looked last weekend and Amazon had 6 sites up where people could have signed up and they haven't done it, or you ask the employee, how many times they've tried, and you start to have that feeling that they're big fakers, or they took their PTO day that you gave them to go get vaccinated, and then they posted on social media that they, went to the beach or something. We're going to enter into that area where we might be looking at discipline being justified, but it's going to be factually intensive.
All right, one last call for questions. And like Catherine said, she will be sharing this presentation with me, and Jackie and I will work together and After every meeting, we do send out a what you missed. So it usually is out by the Friday after the meeting. So the next day or so, just keep your eyes on your inbox and look for that what you missed email.
Well, thanks for having me. I know it's a lot of information, and I know I told you to go read a bunch more information. It's hard to condense, but it is out there. If I can help you navigate something on the website too, just let me know. And good luck, everybody. Stay safe and healthy.